So quickly look at another common issue that what affects women. This is what is known as what uterine fibroids. Right. So here is just trying to look at the different locations you can find uterine fibroids. They can be at different places in the uterus. So uterine fibroids, of course, you can see that they are just growths. Like something is growing in the uterus. It's not supposed to be there. You understand? Because I'm talking to medical students here. I'm also talking to women that came here to learn about themselves. So I have to simplify things as possible. So uterine fibroids, you should know that in medical terms, we also call them what? Leiomyoma. Alright, so in medical terms, we also call them leiomyoma. So they are non-cancerous growths of the uterus. Now they are made up of muscles and connective tissue. Alright, so they are non-cancerous. That means if they are growing here, they will just stay here. They will not go to another part of the body. Do you understand? Yeah. So they affect about 80% of people with uterus. That's women. Now we say people with uterus because in our world today, a man can go and do a surgery and have uterus. Okay. So by the age 50, while many cause no symptoms, other ones can significantly affect the life of the woman, right? So what are fibroids? First of all, you should know that you see them. They're those growths in the uterus, they are not supposed to be there. Alright. So for their size, they range from just a little seed to a melon. Like you can see a very big fibroid, Number, you can find them one or you can find them many. Alright. Location, so where they are found, the location where they are found depends on the issue they will cause. You understand? So for the types, you have intramural. So intramural is within the uterine wall. Okay. We have the subserosal. This is on the outer surface of the uterus. Okay. See subserosal here. All right. Then we have the submucosal. This one is inside. Not inside. This is beneath the mucosa. That's why they say sub. Sub is under. Just under the mucosa. Then we have the pedunculated. Pedunculated should be this one. This one is inside that uterus and is dangling. Alright? Like it's swinging. So that's why they call it peduncle. So common symptoms is a woman that have uterine fibroids will complain that her menstruation is so much, So pelvic pain or pressure, that's heavy or prolonged menstruation, that's so much menstruation. Also pelvic pain or pressure, you are urinating so frequent or there's difficulty in you emptying your bladder. There's constipation when she's having sex, there's so much pain, there's lower back pain. Alright, anemia, that means what? She's losing a lot of blood to the extent that it's showing now, So infertility or pregnancy complications. So she's finding it difficult to actually get pregnant. So diagnosis is a pelvic examination, ultrasound, alright, MRI, that's basically they are trying to actually image the inside to check it out. Then hysteroscopy or sonohysterography, right? Then biopsy can help you pick it up. So treatment options is what? Now the treatment depends on the size of the fibroid. How big is it? Also depends on which location is the fibroid. So it depends on the size and location of fibroids. Alright, and if the woman you are dealing with, is she looking forward to give birth again, or is she done with her fertility life? So non-surgical approach is what? Hormonal therapy, that's hormonal birth control, because you want to regulate the bleeding, that's the blood loss. Then gonadotropin releasing hormone agonist, this ones will help to shrink the fibroids. Then tranexamic acid or non-steroidal anti-inflammatory drugs, those ones will reduce the inflammation that usually comes with this condition. Then iron supplements, this one is basically for people that have lost a lot of blood, so you can be losing iron along, so you want to replace iron. Then surgical options, you can do minimal invasive options like uterine artery with embolization, MRI guided focus ultrasound. Then some other surgical approach like what myomectomy. This one you are removing the fibroids. Then hysterectomy. This one you are removing the whole uterus. So that's just what this one, alright, fibroids or leiomyoma simply means.